more coronavirus cases. We're here today to address the state of coronavirus risk here in Illinois, which remains low to the general public, and we want to update you about our collective preparedness if conditions change. Joining us today are Chicago Mayor Lori Lightfoot, Illinois Director of Public Health Dr. Ngozi Ezike, Director of the Illinois Emergency Management Agency General Alicia Tate-Nadeau, Cook County Department of Public Health COO Dr. Terry Mason, and Commissioner of the Chicago Department of Public Health Dr. Allison Arwady. Our top priority is keeping Illinoisans safe, and to this point, Illinois has successfully contained the virus to 2 confirmed cases, and both patients have fully recovered and returned home. Illinois was the first state, and remains just one of a few states nationally, able to test for the virus known as COVID-19. And next week, as a precautionary measure, and so we can test for and respond to any potential cases, we're expanding to 2 additional testing labs beyond Cook County to increase our testing capacity statewide, one in central Illinois and one in southern Illinois. Additionally, following the recommendations of the CDC and in lockstep with a few other large population states, we are beginning voluntary testing at select hospitals to gather statistics on the presence of the virus in our communities. And we'll be extending that effort to our other partner hospitals statewide. Our Illinois Department of Public Health has launched a statewide COVID-19 coronavirus hotline and website to answer any questions from the public or to report a suspected case. That phone number is 1-800-889-3931 and online idph.illinois.gov. And I'll repeat those again later as well. While the risk to the general public remains low, we want you to know that our state and local agencies and officials are using every tool at our disposal to ensure the public's health and safety are well guarded. I want to be clear, the best thing the general public can do at this time is to continue with the same precautions that you take during flu season with renewed vigilance. Take care to wash your hands. Stay home if you're sick. Cover your mouth and nose during any coughs or sneezes. And clean often touched surfaces or objects frequently. And please visit a doctor if you're experiencing any symptoms, particularly if you or a loved one recently traveled abroad. What we know about COVID-19 is that it causes mild illness in otherwise healthy people, but more serious illness in the elderly and infirm populations, that it's spread person to person, and that it is most contagious when a person is more symptomatic. IDPH Director Dr. Ngozi Ezike will further speak about the latest information that medical experts know about the virus in just a few moments. As the CDC has said, therapeutics and vaccines are under development, but these community mitigations, like hand washing and staying home when you're feeling sick, are our first lines of defense. Illinois has one of the nation's leading public health systems, and our experts have been proactively preparing for this situation. Our Illinois state and local agencies and officials have decades of experience in developing responses and preventative measures for outbreaks. We're ready to put the full weight of the state behind a full-fledged response when needed, if we meet those thresholds. I want to emphasize that since the earliest days of my administration, a little more than a year ago, my agency directors have been coordinating preparedness throughout the state for any and all emergency situations. Last August, our Illinois Human Services Agency, working with the Department of Health and Human Services, the rest of our state agencies, as well as FEMA, have run a contagious disease simulation exercise for potential outbreak situations. And in a few moments, my emergency management Director General Tate Nadeau will talk more about those exercises and what they looked like, as well as IEMA's coordination with local health departments, hospitals, EMS systems, and clinicians to prepare for all necessary action. I have personally been on calls and in meetings with the United States CDC, as well as the United States Department of Health and Human Services, and will continue to use every resource available to keep Illinoisans safe and to make sure that the public remains as informed as possible. This is a situation that has demonstrated an ability to evolve rapidly, and it's my priority that as the information changes, that you will have all of the available information that we can give you. We will continue to communicate with you every step of the way. And now I'd like to introduce Mayor Lori Lightfoot to talk further about our collaborations with the City of Chicago. Mayor?
Thank you, Governor, and thank you all for being here. As we heard from the Governor, there really is no cause for alarm. Nonetheless, leaders here in Chicago and across Illinois have really done an outstanding job in executing a coordinated response to this issue of public health. And I want to emphasize coordinated response. Here in Chicago, we moved quickly when we got the directive from the White House back in January to make sure that we were implementing additional screening measures at our airports. We've collaborated with dozens of our airline partners and staff and the CDC, HHS, as well as Homeland Security on this issue, as well as with local and regional partners for intervention and testing, as the Governor has explained. And for weeks now, I have personally been engaged with mayors of cities across the country, from Seattle, San Francisco, Los Angeles, Washington, D.C., New York City, and others as the airline issue has expanded, to make sure that we are understanding what's happening across the country, that we are using best practices, and that we are in coordination with each other and supporting the efforts of cities across the country to make sure that we have a nationwide response that meets the needs of our various residents. And I want members of the public to know that for weeks now, as the governor said, we've been actively engaged to address the issues of this novel virus with our partners at the county, state, and federal level. And I have great confidence in the public health system response and the infrastructure that we have built to address the needs that we've seen so far, in any event that we need to be more nimble and respond and ramp up the response. As an extra precautionary measure, the Chicago Department of Public Health will also be working with the Illinois Department of Public Health and several other local hospitals to expand testing for people with respiratory symptoms in an effort to diagnose their cases as quickly as possible in the event that that's necessary. And CDPH Commissioner Allison Arwady will elaborate on those details in a moment. While we continue to closely monitor the situation, I want to stress to residents that the chances of contracting the virus continue to remain low. Our residents should continue and enjoy the city, its neighborhoods, particularly Chinatown, and its amenities as they normally do. Fear cannot guide us in this moment. Thoughtfulness and preparations are the rule of the day. Our teams train for situations like this all year round. And have detailed and comprehensive plans in place. Next week, I will be in attendance as our key agencies conduct a tabletop exercise led by the Office of Emergency Management and Communication, which will bring us all together to run through a variety of scenarios to ensure that Chicago is ready for the potential challenges posed by this virus. This will be adding on to the tabletop exercises that routinely are part of the regular cadence of making sure that we prepare for any kind of emergency, including one involving a virus outbreak. This is exactly the type of preparedness that we have always enjoyed and continue to demand from various departments, so that residents know they can count on the City of Chicago, as well as our coordination with our county and state partners. As state, county, and city leaders, we recognize the circumstances surrounding any evolving threat, and we have systems in place to respond quickly and thoroughly to meet whatever challenge comes our way. And again, I want to commend Governor Pritzker, IDPH, our partners at the county, and the entire network of public health across the state for stepping up and continuing the coordination to make sure that we're offering the best possible response to members of the public on this and any other emergency. And at this time, I'll invite Dr. Ezike to the podium to say a few words. Doctor.
Thank you. Good morning. My name is Ngozi Ezike. I'm the director of the Illinois Department of Public Health. Thank you, Governor Pritzker, for your incredible support of public health and for inviting me to share what we're doing to protect Illinoisans from coronavirus. I would like to express my deep appreciation for my esteemed colleagues in public health who are with me here, and to all those who are here and who are working to protect public health. Let me start by reiterating that the risk of infection to Illinoisans is low. However, we have to plan and prepare for all possibilities. Please be confident that the Illinois Department of Public Health will communicate quickly and transparently if there are any changes in the risk level here in Illinois. As the governor mentioned, I'd like to share some important information about this virus and the current public health situation here in Illinois. Our knowledge of coronavirus increases every single day. We understand that the virus is primarily spread through person-to-person transmission. Again, it causes mild illness in otherwise healthy people, but potentially serious illness in the elderly and immunocompromised persons. Finally, we know that it's most contagious when sick persons with symptoms are at their peak. So among some of the questions that we are working on to answer is, how virulent is the COVID-19 strain of coronavirus? And so we have epidemiologists and clinical specialists throughout Illinois, the United States, and worldwide working to understand its specific characteristics. In terms of the severity of the disease in the U.S. and Illinois, it is important to note that to date, every person in the U.S. that has contracted the virus has made a recovery, a full recovery. So in terms of the degree of transmissibility of this virus, we are looking forward to our epidemiologists' review of data, and there are upcoming medical papers that will continue to inform us about how easily this virus is moving from person to person. Lastly, as you heard the governor mention, there is currently no vaccine or medical treatment, but they are under development. Again, the 2 Illinois cases responded well to inpatient hospital care and fully recovered from their illnesses. And patients around the country have received supportive care to keep them as comfortable as possible while their illness has run its course. The governor has already mentioned the steps that Illinoisans can take to reduce the spread of disease through everyday practices, reducing germs on your hands and surfaces combined with self-isolation when you are ill. Those will have a tangible impact on the spread of illnesses like coronavirus. Finally, if you have not received your flu shot, I encourage you to do so. It's not too late, and avoiding the flu will relieve the pressure on the healthcare systems by reducing the number of sick people seeking help. IDPH provides numerous guidances and numerous guidance documents in more detail on its coronavirus page, and you can ask questions day or night by calling the hotline that Governor Pritzker mentioned. Again, that number is 1-800-899-3931. You can also have access to our dedicated email at dph.sick@illinois.gov. Thank you, and I will look forward to questions at the end.
Thank you, Dr. Ezike. And now to talk more about the significant statewide preparations that we've been working on for not just weeks, but for months and frankly for years, from local, county, and state government to our hospitals, our private and public workplaces and schools. I want to invite our IEMA Director, General Tate Nadeau.
Thank you, sir. Good morning, everyone. We're here today to talk about some of the monitoring that we have been doing from the very beginning of the coronavirus outbreak. The state of Illinois has been looking and monitoring both international and national events related. We have also been coordinating directly with our local partners, some of which are here today with us, and also our state and federal partners. An example of some of our federal partners that we've been working with is DHS, FEMA, and Health and Human Services, just to name a few. We're also talking with other states to develop best practices. This is an open line of communication, and it's key to quickly identifying any regional or national trends that we might see. We have been enhancing our state's influenza plans for more than a year, and in fact, as the governor mentioned earlier, last August, we held a 4-day exercise with not only the state of Illinois, but the federal government and other states to look at a scenario that looks very similar to what we're seeing today with the coronavirus. In addition to that, the Governor's Homeland Security Executive Committee proposed that we establish an interagency strategic planning cell to ensure that our emergency plans are up to date to address new and emerging threats. Since the inception of the coronavirus, this team has been meeting on a regular basis and is fully engaged in the health emergency. Health emergencies are not new to either Illinois or to our nation. It's important to note that we have already gone through and saw SARS, Ebola, H1N1, and Zika, just to name a few. And based on those, we have developed best practices. And as we encounter new things, we incorporate those into our best practices. As a matter of fact, Illinois Department of Public Health has a preparedness branch which works regularly with our agencies to ensure the safety of our residents. We do this through regular tabletop exercises, revising our emergency plans, monitoring emergency threats, and coordinating with our local, state, and federal partners. Based on the information available at this time, we do not see a need to alter our daily routine, but the public does play an important role in supporting our efforts to contain the spread of the virus. It is cold and flu season. There are simple things that we can do to stop the spread of germs. As been mentioned several times before, cover your cough, wash your hands, don't go to work or to school if you're ill. This guidance has been followed for years, it's tried and true, and we recommend that we continue to conduct it today. At this time, I'll be followed by Dr. Mwati.
Hello, everybody. We have a lot of speakers, so I'll say I fully agree with the excellent advice that's been given to date, and I'll just fill in a little bit of the local piece from the Chicago Department of Public Health. So thanks first to the mayor and her team who have been really supportive, and to the agencies across the city. We've had a coordinated effort across the city, just as the public health effort has been coordinated across the county, the state, and even federally. So right now, we've had more than 100 staff just at the Chicago Department of Public Health involved in our local COVID-19 response to date. Right now, Chicago Department of Public Health staff are at O'Hare Airport, as they are every day, connecting with returning travelers, distributing thermometers, collecting information as a complement to the CDC's federal screening for incoming travelers. Right now, Chicago Department of Public Health staff are monitoring hundreds of recently returned travelers and arranging COVID-19 testing if these travelers develop symptoms like fevers or coughs. We're monitoring hospital bed availability in real time. We're regularly educating and updating our healthcare partners as the CDC guidance continues to evolve. We're supporting people in isolation or quarantine. We're helping clinicians across the city assess patients who have travel histories and symptoms. We're answering public calls, and we're developing and sharing accurate, up-to-date information for all kinds of partners. You all heard the change in stance this week as we've seen further spread of coronavirus across the globe. We've now seen it on every continent except Antarctica. What I want you to know is that here in Chicago and here in Illinois, our public health systems are strong. We are at a point where we are focusing all of our resources on every individual case. So just as you saw, and you'll hear some more about the success we had with the first 2 cases here in the Chicago area, putting all of the resources in, doing all of the follow-up that was necessary, tracking healthcare workers, tracking folks in the community, really making sure we were not seeing further community spread. That remains our approach. But we are also looking ahead. We know that it is not possible to quarantine the whole globe, and that as this virus continues to spread throughout really the world, we want to be ready here. We'll be ramping up testing to be able to do more possibility of detecting cases here in Chicago and Illinois. And I want to thank the hospital partners as well as the Illinois Department of Public Health lab here in Chicago that's really been an amazing leader in terms of the testing space. And we'll be developing very specific guidance based on all of this planning that we've done to date for child care facilities, schools, universities, businesses, community and faith-based organizations. You've already heard the hotline and the state website. I also, for Chicago-focused businesses or others, I will refer you to www.chicago.gov/coronavirus. So with that, I will turn it over to Dr. Mason from the Cook County Department of Public Health, and I really thank you all for being here and your continued interest in coronavirus.
Thank you, Dr. Alberti. Thank you, Governor Pritzker and Mayor Lightfoot. Excuse me. And on behalf of the Cook County Department of Public Health, we want to thank all of the agencies, those in the front end and the back, that are involved in helping to prevent the spread of COVID-19 in our area. And I must say, it's been, as Dr. Waddy has already alluded to, a really combined effort. The Cook County Department of Public Health continues to work closely with the Illinois Department of Public Health, Chicago Department of Public Health, and the Centers for Disease Control, and we will use our resources to minimize the risk of spread in our communities. The Cook County Department of Public Health works closely with other agencies to manage the 2 confirmed cases that the Governor and Dr. Waddy mentioned earlier that were in Illinois. This collaboration resulted in the best possible outcome for the 2 cases. This demonstrates how classic public health works, and experts work together to end up with the result where both these people, as has been mentioned already, are now back at home doing their regular jobs and involving themselves with their family as they used to. While we continue to learn more about the virus, we have a singular goal, which is to reduce the impact of COVID-19 by detecting new cases quickly, and thanks to the new state lab for being able to help us do that, minimizing the spread of the disease, and protecting the health of community members. We have enhanced our response plans, working with CDPH, IDPH, and CDC and local hospitals to expand the testing for COVID-19 in an effort to diagnose new cases quickly and prevent community spread. The city, county, and state have responded to other disease outbreaks in the past and have been working in lockstep to put systems in place to respond to this new virus. Thank you.
Thank you very much, Dr. Mason. And once again, I want to offer my gratitude to the phenomenal team that's standing with me today, to the mayor, who's done such a terrific job helping to lead on the city level, and for the many, many individuals working behind the scenes to contain the virus and to prepare for any potential spread. And let me say one more time, I want to remind everyone to take special care to operate with the same precautions you take during flu season. And so when in doubt, stay home and see a doctor. And again, dial 1-800-889-3931 or email dph.sick@illinois.gov if you have any questions or need to report a suspected case. Thank you very much, all of you, for coming, and we'd be happy to answer any questions that you may have. I'll turn it over to our Department of Public Health Director, but I'll just say that the state's epidemiologist is what you're talking about, and I think, yeah, the director, I'm sorry? Yeah, it's okay. That's fair enough. But our state's chief medical officer, let me turn it over to her.
Thank you for the question. So we have had a departure in our state epidemiologist position, and we're happy to continue to work with her as she transitions to a job at Chicago Department of Public Health. But in place, we have our acting state epidemiologist, who's a CDC-trained specialist who has served in the role of state epidemiologist for Illinois in the past, has served as director of the agency, as acting director of the agency in the past, so brings decades of experience, has worked closely on the H1N1, SARS, Ebola. So we are fully staffed at the Illinois Department of Public Health and in great position to handle this outbreak as we continue to collaborate with our partners throughout the state. Correct. He's acting at this time, and we will find a permanent placement in short order. Thank you.
How confident are you in Vice President Mike Pence leading the national effort to respond to coronavirus? Do you have confidence in him?
Here's what I know. We're doing everything here in the state of Illinois that we need to do to protect the people of Illinois. The health and safety of the people here is what my primary responsibility is. We are doing sentinel surveillance across the population this week, next week, and continuing to make sure that we know the statistics, whether there are, in fact, is an outbreak of any sort. We're doing everything we can for preparation perspective and have been doing, frankly, for months. And then as COVID-19 arose, we began focusing specifically on that. But we do not rely upon what's going on from the White House. What we rely upon are the medical professionals and the CDC in Atlanta, who we've been working very closely with for some time now. The phone number is 1-800-889-3931. All I'm saying is we're not relying upon the White House. We, in fact, have one of the best public health systems in the country. And so you've got experts here and standing behind all of these folks who are highly capable of managing the COVID-19 that's come upon us. So.
Yes, sir.
So regarding preparedness, we were looking at how schools in Chicago area and outside were planning for preparedness. And I was wondering, is deep learning a part of the discussion for Chicago schools specifically, if it comes down to that?
Well, look, I don't want to really deal in hypotheticals. I think the takeaway from today is a couple things. Number one, the risk is low. The level of preparedness is very high. And in the event that we need to scale up our efforts, we are uniquely qualified to do so. As you've heard from the medical professionals, and the governor's 100% right, that's what guides what our plans are. They've been through this. They're battle tested, whether it's SARS or Ebola or Zika or H1N1. These folks have been through it and are constantly planning on a regular basis. As you've heard, there was a tabletop exercise just last summer that all of us participated in that anticipated, and the problem was a virus that came from China. So I think we're well situated in the event that anything happens. Keep in mind, so far, only 2 reported cases in Illinois, and both of those cases were handled very well. They were quarantined, received the hospital treatment that they needed, and now are in full recovery. But we are stepping up the surveillance that's happening not only in Chicago, Cook County, but across the state. And in the event that we see something that warrants further action, we are well prepared to do it. Our teams are in constant conversation every single day. So I think we're well situated to respond.
When you say the risk is low, here's what the World Health Organization said today, this morning. They said our epidemiologists have been monitoring these developments, and the risk of the spread is very high at a global level. So how can you say that the risk is low?
Because we're talking about specifically here in Chicago, in Illinois. Pardon me? Well, I think that when you look at, I think what the World Health Organization was responding to is the spread of the disease starting in China with people who have then traveled into other parts of Asia and into the continent. As you know, as a part in response to the White House directive, travel from China has been significantly restricted, and we are looking at making sure that we're being diligent about the other hotspots, if you will, across the world where that has spread. So none of us can stand here and say there's no risk. But we believe, based upon the diligence of the medical professionals, which you heard directly from them, that the risk remains low. But we've got to be diligent. We didn't say no risk, but the risk is low based upon the data that we know right now and where we're seeing the condition spread in other parts of the world. But we are being extraordinarily diligent, which is why we're stepping up the surveillance of folks who are coming to hospitals, in doctors' offices, so that we can get ahead of this in the event that there is another transmission or spread here in the city. So I feel very comfortable with the way in which we've built the infrastructure and the ongoing diligence that's been in place for weeks as soon as we knew that this novel virus had started to spread in China.
Mayor Lightfoot, you mentioned the tabletop exercise. When is that taking place next week? And could you, for an average citizen, explain what that is?
So
Exactly, I was just going to have that.
I'll invite Dr. Arwady, but let me just say what a tabletop exercise is you take a potential problem and then you add different scenarios and layers to it. So you bring all the people together that would be required to address and respond to a problem. You add layers of complexity to it, and then the people around the table, literally the table, start responding. So that's what we're talking about. But Dr. Arwady can probably add a little more texture to it.
I'll fill in. So there's planning next week to look at that at the city level. But in terms of filling in what some of that sort of large-scale exercising looks like, the exercise that folks have been referring to last summer was actually a two-part federal pandemic influenza exercise where we had the opportunity to really look in great detail, all of us, about what we would do where you potentially had, the emergence of disease. And so in the spring, the way the exercise was written was actually a new virus emerging in China, with the first cases being seen here in Chicago. And we had more than 200 federal partners actually here in Chicago to talk through what it would look like for us to contain this virus here in Chicago. And so what you've seen successfully happen with these first few cases is what we talked about in the spring. And then in the summer, we had this exercise that was 4 to 5 days long that was not just here in Chicago and not just across the state, but across the whole country. And in that case, we talked about if we were at a stage where we needed to be making decisions about thinking about things like real strain on the hospital system, or thinking about needing to close schools for a temporary time, or some of those bigger decisions that we want to be prepared for. And so in that context, we talked about logistics and legal and economic and communication and transportation needs, mental health supports, childcare, supply chain interruptions, teleworking, emergency operations, all of these things with the public school partners, with universities, with the businesses, because we want to be ready. And so not only did we talk, but we practiced delivering materials to the hospitals here in Chicago when they had needs. We practiced setting up physically mobile care stations and field stations and command posts if we need to be expanding capacity. And really importantly, we practiced using the emergency communications and the emergency sort of data management systems that we use. We did all of this in real time. So far, our plans have played out exactly as we have expected them to with these earliest cases. And certainly, we're planning ahead. We know that we're seeing spread of this across the world. But the work that has been done here locally has us prepared for this in all kinds of ways. We'll adapt as needed as conditions change. We're all going to be very transparent if we have an additional case or if there needs to be any change in the guidance to the general public. But as you've heard loud and clear, right now here in Chicago, the risk to the general public remains low. We're confident in that, and we will update if there are changes to that down the line.
Doctor, what recommendations do you have for parents in particular? What should they
so I think right now it's cold and flu season here in Chicago, and coronavirus is a respiratory disease, just like influenza is, and the spread is similar. And so helping children understand, it can be scary when you're hearing these reports, helping them understand that this is a virus like the flu, like influenza, and the things that they can do to protect themselves against the flu are actually a lot of the very same things that would protect them against coronavirus. So teaching children to wash their hands well, before and after they're eating, before and after they're using the bathroom, teaching them literally wash your hands for saying happy birthday to yourself twice. It takes 20 seconds. Like, that's how you can actually get that ingrained. And be thinking about, talking about why it's important if children are ill, if they have fevers, why they should stay home, and why, and how that's some of how we stop the spread of disease.
So,
A quick question, if I can, just on a quick other topic. There's been some fresh and sharp criticism of the city of Chicago by Immigrations and Customs Enforcement in the last 24 hours about the status of Chicago as a sanctuary city.
Can we stay on
Just
topic for
one
1 second?
brief question, if that's okay.
I promise you, but we stay on topic. We have 20 school reporters here who are here for coronavirus.
And I'd like to just add something to something that Dr. Arwady said. The preparation has been local, at the local level, the county level, the state level. You've heard a lot about that. On a national level, I have been on numerous calls and meetings with other governors and state leaders of other states. We are sharing information. In many cases, other states have come to us for advice about what they need to do in various areas because we are reasonably well prepared here. And I'm very proud of that fact. I'm proud of the people that are doing this work because they have real experience at it. Our leader of our Illinois Emergency Management Agency, aside from having been a brigadier general, aside from having the experience at emergencies, having worked overseas in a number of posts, also was the head of the Chicago OEMC before she became the leader of our Illinois Emergency Management Agency. So just one example, the experience level here is very high. These tabletop exercises, I was part of one on a different topic, but let me just be clear, they're very comprehensive. And the whole idea is to make sure everybody's thinking about every detail that they need to work on in the event that something happens that requires an emergency response. And so we are ready, but let's also be clear, readiness for it doesn't mean that it's going to happen. It means that if there are changes in the condition, we will be prepared. We have the right personnel in the right places, and we're ready to go.
Quick question, perhaps for Cook County Health, but also for those of you who are talking with hospitals. A lot of you mentioned additional testing. What does that look like? Are all hospitals now required to test anybody who comes in for a checkup?
Yes.
What exactly?
No, thank you for the question. So that is what the governor was talking about when he was mentioning the sentinel surveillance. So we have some participating hospitals that will be taking a set number of samples of people who come in who have flu-like illness but maybe don't end up having the flu, that we will start looking at those to make sure that they don't have coronavirus. And so that will give us an idea if there is community transmission and will help direct us in the next steps and efforts that we need to do towards the COVID-19 response.
Not everybody gets like a small
It's sampling. It's sampling. Thank you.
testing labs aware that we have 3 testing labs in Chicago, Carbondale?
Right. So we have 3 state labs in Chicago, Carbondale, and Springfield that will all have the capacity. By next week, every lab will have the capacity to test for the coronavirus. But the patients will be seen in the hospitals and in emergency departments, but those samples will be sent to the lab, to the state lab.
Just had one thing about the tabletop exercise. One more question about clarification. Which day is it next week, and who exactly is going to be there?
So again, the tabletop that was mentioned there is a city-level tabletop, so led by the Office of Emergency and Management and Communications. It's going to be on Tuesday, and it will be focused on really the city organization response. But these same things are happening across the county, across the state, across federally, and building on the work that we've done. But it's the right moment to dust off your plans, make sure everybody is on the same page with what we need to do.
I think General Nadeau wanted
I think it's a good point that you bring up the tabletop exercise. And as the doctor mentioned, this is really where we take our plans, We develop a plan, we look at it, and now we have an opportunity to sit down and ask each other the really hard questions. And once the city completes theirs, we'll have people that are present for that. That information will be shared up and down the line to ensure that we have coordination and integration of all the plans, both at the local level, at the county level, and at the state level.
The state was doing sort of a survey assessing on gowns and masks and gloves. We're already hearing that if folks try to go to places to buy some of those, that the shelves aren't there. What do you tell people who are concerned who feel like they need a mask?
Well, again, we have the supplies that are necessary at the state level, at the city level, for healthcare personnel, right, for the people who interact with the public, should that be necessary. But as we said, we need to treat this like you would the flu, that there's no need for people to go out and get a mask, that the fact is that all of the precautions that you would normally take for the flu you could take here, and we believe those will be effective.
So healthcare workers are covered, the public, calm down.
Well, I'm just saying, we want to make every person that works for, that is interacting with the public on this subject to keep the public safe and healthy. We are making sure that they are in a position to provide that help without getting sick themselves. Any other questions on topic?
Yes, sir. Your ICE question.
Yes. What about ICE? In the last 24 hours, the Immigrations and Customs Enforcement has been very critical of the city of Chicago because there was a gentleman who was arrested and deported back to Mexico only to make his way back to Chicago. And there's charges now on sexual assault of a 3-year-old girl. And ICE said today that it's irresponsible for lawmakers in Chicago that allowed him to walk free and prey on our most vulnerable. How do you respond to ICE?
Well, I assume that's coming because I had a conversation with the director of ICE last week to talk about why it was that he decided to arrest this person after he dropped off his daughter at school in front of an entire school community and traumatizing them. So we had a very candid and blunt conversation. I'm a former federal prosecutor. I know how surveillance is done. And really, if they believed that there was a serious issue around sexual assault, why did they wait until he left his home with a child? They could have done that at any point along the line, and particularly in the home, because I'm sure they were doing surveillance of him. So, look, they're critical because we have said very clearly we are a welcoming city, we're a sanctuary city. Chicago Police Department will not cooperate with ICE on any immigration-related business, and that's affected their ability to conduct immigration raids across the city. But that's exactly our intention. We have to make sure that our police department is seen as a legitimate force in all communities, and we cannot do that if we're participating in raids with a weaponized and politicized ICE. We're not doing that in Chicago.
Is there some sort of partnership that can prevent this kind of atrocity from happening again? Is there better bridges to be built between the city and ICE so that a heinous crime like this doesn't occur again?
Well, look, we are doing what's necessary to keep our residents safe all the time, 24/7. And we have federal partnerships and relationships that are very good, vibrant, and essential. But we have to be clear that we are having those partnerships in a way that is consistent with our values as a city. And if ICE is complaining, then they should do their job better. And they shouldn't do things that are traumatizing young children. That's not acceptable. And I was very, very clear and blunt about that. How is that right? There are many points along the way that they could have, if this person had a valid warrant signed by a judge, that they could have arrested him. They chose to do it at a school after he dropped off his daughter in view of the daughter and all the other children and parents that are out there. That's just unnecessary. And I'm going to push back against that every single time.
All right, thank you, everyone.
Thank you.